One of the ways that healthcare providers have responded to the increasing opiate epidemic is to institute something called a controlled substance contract or a prescription agreement or something along those lines. Pain contracts or controlled substance contracts are just that. They are agreements between a physician or a provider, a prescriber, and their patient that says, on the prescriber side, here's what I'm willing to prescribe for you, and here's how we're going to manage your pain in a global sense or manage the situation in a global sense. On the patient side, it's an agreement that says, I won't exceed the parameters, the limits that my prescriber has set forth in terms of what I use and how I get it and those kinds of things. So common terms in a pain contract or a controlled substance contract are things like no replacement for lost or stolen medication. So you get 30 Vicodin from the physician, or the patient gets 30 Vicodin from the physician. Somebody steals it from them 2 days later, tough luck. Not going to be refilled ahead of time. That's a very common provision. A second common provision is random drug screening. So that's an agreement that says at any given moment, any office visit, essentially any time, we ask, you have to, or the patient has to take a drug test to prove two things. One is that the medication that they're receiving is present in the urine. And that may sound kind of silly, but the purpose is essentially, let's make sure that our patients aren't using their prescription and selling it. Let's make sure that they are actually taking the prescription we're giving them. The second element to the drug test is that almost all controlled substance contracts require the patient to agree that they will not use other drugs, legal or illegal. So if you have a controlled, or a patient has a controlled substance contract for Vicodin, most controlled substance contracts would allow a physician to discharge them or refuse to prescribe Vicodin should they test positive for methamphetamine or heroin or other drugs that were not prescribed by the physician. And it is important to know that those don't have to be illegal drugs. So if a controlled substance contract is for a patient to receive an anti-anxiety medication like Valium or diazepam, and they have a random drug test and it hits positive for hydrocodone or something like that, that's still enough to discharge a patient from a controlled substance contract, still enough for a physician to decline to further prescribe. So a controlled substance contract is essentially supposed to be a roadmap for how we will manage patient pain or discomfort, and it's an agreement in which if there's a violation of the agreement, the physician may then refuse to prescribe controlled substances. They may discharge the patient from the practice, a whole number of things. So pain contracts are common, and obviously you should note those in the EMR if they exist.